Okay, Assalamualaikum everyone. Okay, we already
Waalaikumsalam.
have everyone here. Okay, this is our first discussion for our assignment 2 to make a suitable health promotional tool targeting eye problem for the community of our choice. Okay, so the things need to be done today are determine the community and determine the tools, and also we can divide the parts for the final presentation. So Najah as administrative coordinator, you may take note our discussion today. Okay, now pass topic expert Shawra.
Okay. So for our health promotion, so Madam suggest us to do 3 target. First, for the diabetes patient that do not have diabetic retinopathy, and second, diabetic patient with mild diabetic retinopathy, and for the third, diabetic patient with advanced diabetic retinopathy, because for the 3 group, we it has to be a different content for us to give education for the patient, right? Okay, so do you have any suggestion? Which group that we should do all the 3 group, the 3 group target, or just one or two? Anyone?
I think maybe we just ask only one group. Okay. I think maybe only one group. Maybe easy for us to focus on that group only. How
Oh,
about the other person? But we need to.
I agree with Najah because I think
one group. So
we can reduce the amount of information to put in the our newsletter.
Yes,
okay,
because
Atira.
if we focus to only one group, we can focus more on them rather than focus on 3 group, but we can focus more on each group and lack of information to give to the 3 group.
Okay, so one group only, eh?
Yes.
Yes.
So our topic, we do the health promotion with patient education, right? Rather than the awareness. Rather than campaigns.
Yes.
Yes.
It's
Because
easier.
patient, yeah. So one group, you think which one that we should target? So in my opinion, I think that diabetes that have no diabetic retinopathy, because it easier for us to give education for them.
Yes, I agree.
No? Okay.
Yes, I also agree with that.
Yes, I agree, but we can consider the mild diabetic retinopathy too, because if we focus on this group, we can look for the awareness and education to manage the progression of diabetic retinopathy.
Oh, okay, good
Yes, I
idea.
agree with Atira because
Because
okay, I agree with Atira because I think early DR they have higher risk compared to the diabetes only, right?
Yes.
so which group that we should do?
how about we make
Raise
a poll,
hand.
to choose between the group.
Huh?
That's a good idea.
Make a poll.
I will make a poll
Yes.
on Telegram.
All right.
Okay, Atira.
Okay, thank you.
Okay. Based on the majority, I think the diabetes patient without DR is the more suitable subject that we need to focus on.
Yes. Okay.
Okay.
All right.
I think good that we the target to the patient that have no diabetic retinopathy because for our participant I think that many that have no diabetic retinopathy, right?
So we need
Yes.
to do the prevention before it happens.
Yes. Okay. That's all.
Okay. So now we will continue with the two that appropriate with our target. Okay, since our target is diabetic patient only, so since we can only do the virtual tools such as the poster or such as posters. So do you guys have any idea about the tools that we can meet?
I think I will go with live Facebook because of the pandemic. So in the live Facebook, we can invite our subjects, all of 107 subjects, to watch our live and ask about the question that they want to ask
Yes,
about
I agree
diabetes.
because at Facebook, we easy to engage with the patient because patient, I mean majority patient older, so many of them use Facebook rather than other social media.
But
Yes.
can I know who like give the information to the live feed, to the live Facebook about the diabetic retinopathy?
I think we can do the PowerPoint to give to present to the subjects.
Yes, and so for the live Facebook, is
Um,
we going is we going to talk about the education or we should invite the professional like
Yeah.
general practitioner.
Yes. Maybe we
Yeah.
can invite.
Okay.
I think I think we should invite the professional people because um they might believe someone that is qualified enough to give them information.
however, I think that live FB is maybe quite difficult because we need to invite all of them, and then we do not know how much they have free time to join the live FB. So it's okay, but we can continue with other idea.
Okay.
Okay. Anyone else?
Isa, how about
Yes.
we spread the info through social media such as IG? Like we post about the fun fact or the any info that are related to diabetic retinopathy on Instagram.
I think it's a good idea. However, do you think that the older patient have the IG account?
Oh,
Maybe we can
yes.
use Facebook also. Facebook
Uh,
page.
I think we can link the Instagram account with the Facebook page, like Naja said.
Okay.
What the the maybe what
Broadcast.
no, I mean what you mean a video or poster or maybe just a fun fact to post on the Facebook, but you
Yeah.
need followers and maybe the older people is not interested to the
Mm.
To join the group.
to
And
join the
then
group.
and then for the
Simple.
video, all video I think is include in campaigns,
Yes.
right? So I think we should
We
do
need
the
a lot of time, right?
patient. Yes.
Okay. Is there any suggestion?
Okay. I already discussed with Iza before this that then we found example of flip chart. So I
Yeah.
think it's good for us to provide the knowledge to the patient because it's easy for them to understand.
Yeah.
So,
Since I the PSP with the Shao, we have suggestion regarding the flip card. So I think a flip card is the best tool for the diabetic patients since they go to the hospital for the eye exam for the general examination. So what do you guys think?
I think it's okay. You mean we need to collab with general practitioner and other professional to make it.
yeah.
Yes, which is the general practitioner, ophthalmologist and optometrist.
I
So the patient will
Mm.
yeah.
yeah.
Hmm.
Tira Tira.
Okay, go Alia.
No, I just want to ask.
So
Okay.
as Shaura and Iza said, flip chart. I think the flip chart um, can be seen in the hospital. You know, on the counter, you can see that. Um, so if as optometrist, so if the patient come to the
The clinic.
optometrist shop, optometrist shop or the clinic.
Private. Yeah.
So on the desk, they can flip the flip chart to know the information while waiting for the optometrist, right? So
Yes.
so and if the optometrist can also educate, no, not educate, also educate them with the flip chart. Yeah.
Exactly. Because when they are meeting the optometrist, so after they do the eye examination, so the optometrist can directly give the education to the patient that come to their clinic. So for the ophthalmologist, the general practitioner may also make appointments to them while during the general eye checkup. Eh, general hub. Okay.
Okay.
So okay. I will make a conclusion. So can we vote for the tools that we want to do on the Telegram? Okay.
Yes.
Yeah.
Yes.
Okay. So based on the Telegram, the results show that we do the flip card. So does anyone agree with the result?
Yes, I
Yes.
agree.
Agree.
Yes.
So that's all for me. Okay, so Alia.
Okay. Next, should we move on to the dividing parts for the final presentation? We can make this first. Then next 2 weeks, you can submit your part, so we can review together.
Alright.
Can we
Right.
move on? Yeah. So
Yes.
for the final presentation, the things
Okay.
need to be included. There is seven points. First, evidence of what the problem is. Second, the reason choose the tool. Third, the features of the tool. Fourth, the strategies of implementation. Fifth, aims of introducing this tool. Six, expected outcome from using this tool. And seven, potential benefits to iHealth, other areas of health, or on quality of life. So there's seven, but we are six people. So which point can be combined? So we can have 6 point for each six people. Do you think aims can be combined with what? I think aim and
I think the aim part should
Oh,
combine with outcome. What do you think, Xiao?
I think it's good because aim will correlate with the expected outcome if one person do the part together.
Mm,
Okay. So there is 6 points.
Yes.
Right,
Okay.
Alia?
So which is evidence, reason, right?
Yes.
Yes.
Features, strategies, aim and expected outcome, and the last one potential benefit. So can we divide since we have six people, so we can divide right now?
Yes.
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 Okay, who would like to do the evidence of what
Me.
the problem is? Okay, Atira.
I have a question.
Yes.
The evidence is based on our survey, right?
Yes, from the survey of the assignment one, from
Okay.
the result.
Okay. Thank you.
Okay. So for the reason, you choose the type of hub promotion tools. Who want to do this part?
Me, Anna.
Anna.
Mm.
So for the features of the tool,
Me.
Naisha.
I have a question.
Yes.
For the features, it means like it is a feature. I mean like the physical part of the flip chart. Is it?
Yes. For the features, maybe we can put the physical features, which is make us easier to imagine how the tools function, and also we can describe about the manual maybe. So what do you think, Shao?
I think it's good opinion. And then for the strategies of implementation, who want to do this?
Maybe I can for this part.
Okay.
Yeah.
Now, do you know what you should do for the strategies of implementation?
I think for the strategies, we have already discussed earlier. when we choose the two, which is the collaboration with the ophthalmologist, general practitioner, and optometrist, right?
Oh, okay, good. And then potential benefit to eye health. Alia. So you know what to do for this for the potential benefit.
The advantage of the flip chart to I health, to the patient quality of life.
Okay.
I think the advantages.
Alright. Okay, so for aim and expected outcome, me. So now everyone has question for the part that you should do. No.
I have a question.
Okay. Who? Anna. Okay.
Anna,
Hmm.
for the reason, can I include like the material from the first assignment, which is we suggest we have provide the link to the Facebook page, right? But
Yes.
there is like no one noticed the link there. Can I include that in the reason?
Oh, I
I think maybe
think it's okay.
yes.
Yes.
Okay, that's all.
Okay. Ada?
Tira?
No. Tira no. Okay.
They determine the community and determine the tools, and then divide part for the final presentation. So, firstly, Shaura have discussed about the 3 targets, and we chose the diabetic patient with no diabetic retinopathy because it can from this you can get more information rather than 3 types of the target, and then we can focus more on that target, and we can make a health promotion and also the patient education rather than the campaign. And then IZA is about the visual tools like like poster, live FP, and also spread info through social media and also flip chart. And we have concluded that we choose the flip chart because it is easy for the patient and also the health professional to understand, and then easy to educate with the flip chart during the consultation. So, and then for the last one is the dividing part for the final presentation. There are seven things that need to be included into the presentation, and because of we have the 6 people, then there are two part need to be combined, which is the aims of the introducing tool and the expected outcome. And then I think that's all.
Okay. Okay, that's all for today. For today's discussion. Okay, next discussion, we will update on our roles. Okay.
Alright.
Okay.
Thank you.
Thank you.
Thank you.
Okay.
Okay, before we leave our meeting, I want to conclude for today's meeting. So the objective for today's meeting is